All right, we are here live. It is at a weird time of the day. I get that. My son has some baseball games tonight, so I'm just recording this when I can, and I don't want to go through and edit everything. So we're just going to talk through what's going on here. And there is a lot of fear going on out there around Medicare supplement plan increases, which is warranted. There are a lot of areas and a lot of plans that are seeing historic rate increases, things that we haven't seen ever in this space in terms of how high they are. So I wanted to talk through kind of what's going on, what you can do about it, and then take some questions here for those who are here at this time of day. So welcome, and let's just get straight into this. So I keep a spreadsheet here of what I see when it comes to the increases to these supplement plans. It's going to be little here, but hopefully everybody can see it. Now, supplement plan increases are unique in that the states where these plans are located, the insurance companies file their increases with the state. So when they file that with the state, it is an incredibly laborious process to find the increases that are upcoming. And so there are certain sources that will gather this information and then kick it out. So I'm grabbing it from there. And then the other best source for us from an agent's perspective to get these rate increases is from our clients or people who reach out and let us know what they're experiencing, because these insurance companies do not send the agents or the brokers. They don't say, hey, heads up, here's what our increases are. We either find out through these data sources that are trying to pull the data, or from clients like you who reach out and say, hey, I'm with this plan, I'm in this state, here's the increased letter that I got. So that's where some of these are coming from. I want you to notice a few things here. One, you're going to see that it says varies. So United AARP filed a 10.3% increase. It's going to vary, though. That's not the set amount. So it'll depend on which plan you have with Plan G, Plan N, others, and which state you are in. I want to point out the average here. So the average so far, this is not all insurance companies, but the average of what we have so far is 11.9%. We'll call it 12%. The average in 2024 was 9.9%. We'll call it 10%. So it's higher than last year, and last year was higher than the year before. So it's this steady increase that has us a little bit worried, because increases used to hover around the average of 3 to 6%, 3 to 7%. And now we're seeing 10s, 12s from the average perspective. A 10 or a 12 would be incredibly high during those normal years in terms of an individual insurance company having that high of an increase. And now that's kind of becoming the norm. But look here, the low, we have companies that are giving 0%. So as you see these huge increases coming out, if you're on a supplement plan right now, it doesn't mean that you're guaranteed to have massive increases. It's going to depend on where you live and what company that you have. Notice the high here, 51%. That's coming out of California. I have seen two 40% that would be in Nevada and California as well, and Illinois, and then a 38% in California. So California in certain regards is getting hit kind of hard. Nevada, Illinois, you're getting hit pretty hard. So we're going to talk about what you can do when this happens, but I want to go a little bit more into, let's look at that 51%. The average supplement plan G for a 65-year-old nationally is $160 per person per month. That's the average. Yours could be higher, yours could be lower. It's an average. I get people who yell at me all the time saying theirs is higher or lower than that, but call it $160. Now imagine that you just got a 51% increase. That is $82 more per month that you're going to see for your supplement plan. That's going to be a total of $242 a month now, when last year it was $160 per month. And then if you're a couple, double that. So these are significant. And that's what I think is obviously scaring people, is that if you're experiencing that, that is hard, especially for those who are on a fixed income or trying to budget for their healthcare costs. That's a big problem. Let me show you this other screen really quickly here, because there's another thing I wanted to point out. CSG Actuarial puts out this information on these rate increases and the amounts that are coming out here. But what I want to point out is the dates. So notice that ACE, I'm just pointing out ACE here. Again, that's going to be small, I think, for most people watching. But ACE, it says effective 8/1/2025. Go down to Aetna, it's 7/1/2025. So supplement plan rate increases are not standardized like the Advantage plans or like Part D drug plans, meaning they don't all come out during AEP, the annual enrollment period, and then they don't push it out there for January 1st to start for everybody. It all depends on the insurance company and that state of when they file those. Those are kind of their anniversary dates. So if you haven't received a letter from your insurance company and you're on a supplement plan, it doesn't mean that nothing's coming. It doesn't mean necessarily something bad is coming, but it just means that your insurance company either hasn't filed that yet and their anniversary date is later in the year rather than earlier. We had a lot of insurance companies submit their rate increases and it got published here in April and May. So that's why we're having this big, huge news thing, and you're seeing a lot of videos about this crazy supplement plan increases because a lot of them were publishing and submitting their rate increases for the later in the year. Here's another thing I want to point out with this. So I talked about last year, the average was 9.9% on a Plan G. Here we're looking at in 2025 so far, the average is a 12.8. So my spreadsheet again isn't everything. This has even more data. And this is for open blocks. In other videos, I've talked about open and closed blocks. This is for supplement plans where they are still accepting new people into that plan versus a closed block where they're no longer accepting people, which I think is even more concerning, right? Because if it's an open block, conventional wisdom would tell us that those rate increases would be lower because you are getting newer, healthier people in. A closed block in general will see higher rate increases than an open block. So this is what we're looking at for 2025. Another thing that I think is a little bit contrary to conventional wisdom is that Plan F theoretically should have higher increases because fewer people are eligible for them. It's lower than Plan G here, again, with open blocks. And then Plan N, for years, it was, hey, if you want to save money, go with Plan N. It's going to be lower costs, and you're going to see lower rate increases on Plan N. And that held true. If you look at 2021, 2022, it's about a 1.5% to 2% difference in Plan G versus Plan N in terms of their increases, Plan N being lower on their increases. And it's still lower, but it's not that much. I mean, it's not like you're seeing a Plan G is going to be a 13% increase and Plan N is going to be 6. It's a 12.8 versus a 12.1. So that's kind of what we're seeing with a lot of this, which, again, I still think Plan N is a great option. You're starting at a lower monthly rate anyway. So a 12% on $120 is not the same as a 12% on $160 in terms of the dollar amount that it's going up. All right, so let's go in right now with what I consider the 3 biggest weaknesses of supplement plans, and then I'm going to get into what you can do about this. The biggest weakness in my mind from a supplement plan perspective, I've got a lot of videos comparing these to Advantage plans or other things, is the cost. Supplement plans have a cost. And so when you're comparing something that has a cost with something that doesn't have a cost, the thing with the cost is going to have that as a con versus the quote unquote free thing. So supplement plans have a cost, and not just when you get it, but these increases that we're talking about. The second is that a supplement plan will only cover the gaps that original Medicare does not cover. That is Part A, which is your hospital coverage and includes the Part A deductible and then some copays. And then supplement plans will cover the gaps of Part B, which would be the deductible for Plan F. Other plans don't cover that. And then the 20% coinsurance with no max. So the weakness with supplement plans is that they only cover that. They don't cover dental, vision, drugs, hearing. They don't cover all that other stuff. You have to buy those plans separately, which adds to your cost. And then the third thing with supplement plans that is a weakness is that if you don't get one during certain periods of time, then you might not be able to get one. And so they're very restrictive in terms of who can jump on a supplement plan outside of specific windows. So we're dealing with a lot of that right now. Obviously, the cost is these increases that we're talking about. It's a frustration, I think, for everybody. And here's something to understand here as well. So let's look at these numbers. These is the total premiums for Medicare supplement plans in 2024, and then the total lives. So everybody who's on a supplement plan is paying premiums. This is the amount that was collected, $37.5 billion. And then there are 13.7 million people on supplement plans, all letters, Plan F, Plan G, Plan N, high deductible G, and all the other letters. There are 10 letters. So that puts the average premium cost per month at $228. So if you're thinking supplement plan, nationally, that's the average cost. Again, comparing that to something that is a $0 premium on an Advantage plan, that is why I think a lot of people gravitate towards the Advantage plan because of the free stuff. Now, there are huge differences in how these plans work. This is not me telling you to go one way or another. And I actually have a question from somebody that asks, should I stay on my supplement plan given what I haven't used it in 20 years. So that's something to consider there. Again, that includes F, G, high deductible G, and N. If you want to know, so Plan G is by far the king in the supplement plan space, meaning more people are on Plan G than any other plan. Then Plan F, but again, people can't get on that if you were eligible for Medicare in 2020 or later. And then Plan N is next, and then all the other letters are under that, and they're pretty minor percentages. All right, the next part of this, so that's cost. the gaps, they cover those gaps really well, but then we've got getting on a supplement plan is difficult. So I wanted to point out, and this is where it really comes into what can you do? If you are impacted by these, what can you do? I'm going to show you the states here. This is just my own little spreadsheet. You're going to see some notes that are Erik's thoughts, and hopefully you don't judge me too harshly on them. If you live in New York, Massachusetts, or Connecticut, you have unlimited open enrollment when it comes to supplement plans. You can switch incredibly easily. Usually with the supplement plans, what's going to happen is it's going to take effect on the first of the upcoming month. So if I'm on one supplement plan and I want to switch to another one, today is June 2nd, and I want to switch to another supplement plan, my new plan would go into effect on July 1st. Very easy to switch. If you're seeing massive increases in these states, work with your agent or broker, see if there are lower cost plans in these areas. These are all community rated states. They're all open enrollment. They have high average costs in general. New York is the highest in the country. So they're all relatively close with these insurance companies that are in these states, but you will find differences. And so there's no reason why you wouldn't just look at lowering your costs through looking at another plan. There's some special states here. Washington, if you're already on a supplement plan, you can switch to a different supplement plan anytime during the year. And it's going from letters B through N, because there's a special circumstance in Washington where they need to make Plan A available to everybody. And if you're on a Plan A, you can only switch to another Plan A. You can't switch everywhere else without underwriting. So if you're on a B through N, then you can switch anytime during the year. Maine, same thing as the other states with New York, Massachusetts, Connecticut, except that you have to already be on a supplement plan. In New York, Massachusetts, Connecticut, you can be on an Advantage plan, you can be on nothing, and then you can jump on a supplement plan without underwriting. In Maine, you get this unlimited open enrollment as long as you are already on a supplement plan, which is the context of what we're talking about here, of people on a supplement plan getting a big increase. I made videos in every state on a 50-state road trip that you can find on this channel, so I don't want to go super in depth about all of these, but go look at Maine. You've got some cool trial rights. Vermont, it's not a state law for open enrollment, but there are a lot of insurance companies that offer open enrollment into supplement plans year-round. Now we have the birthday states. So I mentioned that California has a problem. There's been a lot of big increases in California. You're a birthday state. So if you live in California and you are seeing big increases, work with your agent or broker and try to find a lower cost supplement plan that you could switch to around your birthday. All of these birthday rule states have a little bit different timing around them, whether it's 60 days before, 45 days before, it'll just depend on your state. Illinois is another state that's getting kind of hammered. You don't have a great birthday rule. You have to stay within the same insurance company. You can't hop insurance companies, guaranteed issue, and that stops after 75. So if you're 76 and older, you don't get that. So it's not a great rule in my opinion. Louisiana and Utah. Utah just came out with a new birthday rule, and it started May 2025. You have to stay within the same insurance company, and a lot of these insurance companies have affiliates. You have to stay within the same affiliate. So as an example, Mutual of Omaha has a bunch of affiliates. You can't go from one affiliate within Mutual of Omaha to another affiliate within Mutual of Omaha. You have to stay within the same affiliate. These rules, I think, are garbage because it forces you in the same insurance company, and you don't really get a switch from a G to a G now. You have to switch from a G down to something else. So anyway, those are the birthday rule states. If you live in those states, work with your agent or broker and you're seeing these big increases. Even if you're not seeing major increases, it doesn't hurt to talk to your agent or broker and see if there's something less. Missouri is an anniversary rule. This could be around your birthday, but what it means is it's the anniversary of when you picked up your supplement plan. So if you went on Medicare after your 65th birthday and you went, I don't know, 6 months after your 65th birthday, it's that 6 months after starts your anniversary date. And then you have that time or window to switch every year. Some states that have changes coming, Virginia and Indiana, you're going to birthday rule states, January 1st of 2026. Minnesota is proposing unlimited open enrollment during a certain window of time. That is set to go into effect August 1st of 2026. You'd be able to get a supplement plan either during the annual enrollment period from October to December of every year, or during the first quarter, so January through March 31st of every year. With all of these states, if you have more flexibility to switch your plans, you're going to see higher average costs for your supplement plan. We have some proposals for other states, Nebraska and Iowa. Recently, those have been defeated. That doesn't mean that it won't go through eventually, but they have proposed birthday rules. New Hampshire and New Jersey are proposing the unlimited open enrollment. Doesn't matter if you're on a supplement plan or not, just like New York, Connecticut, and Massachusetts. And then California is proposing a rule like Minnesota. I have gotten a few messages from people in California that are a little bit concerned with this, and I'll talk a little bit about that. As I mentioned, if you have more flexibility and freedom to switch supplement plans, what that means is that your average costs are going to go up. And so we talk about access to healthcare and access to these insurance products. And it becomes something where if you're getting into higher and higher costs, only certain people of a certain income level, especially in retirement, are going to be able to afford these. And so it's going to force lower income people onto Advantage plans and other things. And so California, if you are going to go like Minnesota and make that unlimited open enrollment to where if I'm on an Advantage plan and I get cancer and I can just jump onto that supplement plan without underwriting, I think that's great from the individual's perspective to be able to have that coverage. However, from the insurance company's perspective, to force them to take that on means that they are going to pass those costs and that risk onto everybody else, which is insurance. I mean, that is the insurance game. So it's not like it's anything novel, but what that's going to do is push average costs for everybody up, and then it's going to limit the number of people that can afford supplement plans in general. So again, access, it's this balance of having access and freedom to jump on these with the overall costs. I personally am a fan of birthday rules and birthday rule states, but we'll see where that goes with California. All right, I'm gonna jump in here for some questions really quick if we have any. Thanks for being here, by the way, and thank you. It's Diane for sharing your increases there. 13% in Colorado. 13% does not feel good. Hopefully, in the context of what some others are facing, it doesn't feel as bad. But again, increases like that, when we're averaging 3 to 7 for the past decade or so, 13% does not feel good. Okay, I'm just going to go through and see if we have any questions here. North Carolina, Plan G at about $123 is great. I love that. Yeah, and again, like some of these comments, if you can see them, they're talking about my whole pitch on the supplement versus Advantage thing was not trying to persuade you one way or another. It's just that supplement plans do have a cost. $123 a month compared to what I'm paying for my insurance is fantastic, and that coverage is great. So if you're in those states, that's fantastic. Perfect. Okay, so I've got some questions here that I wanted to tackle. I've got to get to a baseball game here soon, so I am limited a little bit on time, but we'll go through this. If all plans, say Plan G, are the same and one can switch carriers yearly, is there any reason not to go with whomever has the least expensive plan this year? This is a fantastic question, and that is going to apply to those who are in these special states. If you are in a special state where you can switch easily, then sure, pick the lowest cost plan. The one variable you're going to experience with that is there is a customer service aspect to these insurance companies. Not all insurance companies are created equal from a customer service perspective. Things can happen with claims and delays or whether it's approved or not. And the supplement plan has to pay it if original Medicare has approved it. But there are customer service things that can come up. You're only in that plan for a year if that is your strategy, and then you're jumping around every year to the lowest cost plan. So if you are in one of these special states, I don't see anything too wrong with that as long as you understand, okay, hopefully I'm going to a company that has decent customer service that isn't going to leave me high and dry if I do have problems, and I can at least get access to people on the phone. So great question. I don't think there's anything wrong with that. I haven't mentioned Plan F on supplement plans, only G and N. What do changes look like, Richard? So most of the rate increases that I have are going to be for Plan G and Plan N because they are the most popular. From a Plan F perspective, we saw that. Let me get back to one of these. Here we go. Plan F is trending to be very similar to Plan G, just slightly lower on the open books. If it is a closed block plan, it will probably be higher. So that's generally what that's looking like. If you are in a state, this brings up another question. If you're in a state and you're on a Plan F, I got this in a comment in an email the other day. Somebody has been on Plan F for 17 years, and they were saying, I have not used it. I have not used my Plan F. I've seen a couple of doctors, but really I haven't used my Plan F in 17 years. Is it worth it to have it at this point? Should I just get rid of it? And all of my friends are on these Advantage plans that are $0. Should I just go on an Advantage plan instead of a Plan F? So my response there is that is tough. 17 years at average premium cost is going to be about $70,000 in premiums that have been paid over 17, 18 years. And then if you have a spouse, you're doubling that. That's a lot of money to pay for premiums for something you aren't using. If you are in a state where switching is easy or your health is good and you would pass medical underwriting, I would highly recommend looking at something like a Plan G or a Plan N because your monthly costs are going to drop relatively significantly. The difference between Plan F is it's going to cover the $257 Part B deductible. Plan G is not going to cover the $257 Part B deductible at this point. But I rarely see any Plan Gs that would be more expensive, even if you get the deductible that you would have to pay than Plan F. The average cost from Plan G to Plan F is bigger than the cost of that deductible. So if you are in a state that allows this or you're healthy, work with your agent or broker at looking into a Plan G or Plan N to lower those costs. Spouse and I have G. He passed last year. I was hit with a $25 a month increase because no more household discount. Annual increase is $31 more a month and $9 more in October. Birthday. Help, Mary. Yeah. So again, this is the problem with supplement plans. And a lot of insurance companies do offer that household discount. So you are getting a decrease if you are, sometimes it's you just have to live in the same household as somebody else. Others, it's your spouse and they have the same plan as you. So you can see here that I don't know where Mary is, but you can assume that it's an attained age state. So they're getting a $31 annual increase to account for rising healthcare costs, inflation, everything else. And then a happy birthday increase is what we sarcastically refer to it as in October. So there are multiple increases that can happen here. Reach out, let me know what state you're in, and then we can take a look at what your health is, if it's an easy to switch state, and if there are options available to you. I'm so sorry to hear about your spouse passing. I can't imagine what that feels like, and it is one of my biggest nightmares. Okay, in Pennsylvania, got the AARP UHC community rated plan 5 years ago. We've received 2 rate increases each year for the past 2 years. What is going on? This is one of my biggest pet peeves in the supplement plan world. A lot of people get hung up on whether it is community rated, issue aged, or attained age. Get that out of your head. There isn't going to be a massive pro or con to either of these options. Community rated, you're going to see an annual increase every year, just once. Issue age is going to be once a year, and then attained age is possibly twice a year. In every now, usually it's based on your state. There are community rated states: New York, Massachusetts, Connecticut. There are others where all of the plans are community rated. It's not based on your age. Most states are attained age. It is based on your age. So if I get a plan at 65, call it $160 a month. When I turn 66, it's going to go up a little bit on my birthday. And when I turn 67, it's going to go up a little bit on my birthday. So you're seeing potentially 2 increases a year, but those start a lot lower than community rated plans on average. And so over time, will it catch a community rated plan? Yeah, but it's probably when you're 80, 85 years old and you've saved a lot of money in between there. So the point is, don't focus on community rated versus issue age versus attained age. And then what really grinds my gears here is that AARP UHC has a supplement plan that is listed as community rated in, I think, every single state, in almost every single state. It is not a community rated plan in what I just described. It does not work in the way that most people think it does, where it's just not based on your age at all and you're only getting the one increase. It is a plan that is structured to where they have certain discounts, and those discounts fall off after about 3 to 5 years, depending on where you are. And so it's not community rated in that. I get people all the time that are like, I'm in an attained age state, but I really want this AARP community rated plan because it's not going to go up like the others. That's not the case. It turns into an attained age working plan where, just like where Leslie's experiencing, you're getting 2 increases a year on that plan. So just if you're in an attained age state and you see AARP United with a community rated option, it's not what you think it is. Oh, this is the one that had come through, yeah, that I was talking to you about. They've been on it for 17, 18 years. All right, this is a interesting question. What do you think about companies that charge $1,200 for a year to help you find what Medicare plan is best for you and continue assisting you for a fee beyond that first year? I am very passionate about this. You should not be paying anything for help with Medicare. $1,200 a year is insane, in my opinion. Nobody should be charging you for Medicare help in general. There is a group of people that have started to give Medicare advice. They are not licensed agents. So if you're a licensed agent and you are receiving a commission from an insurance company, legally you cannot charge to give advice and to help people with Medicare. I I can't. Not only is it unethical in my mind, but it's illegal. Now, there are others who are licensed agents, but they aren't contracted with any insurance companies and they aren't receiving commissions from anybody. So they are these Medicare consultants that are going to help people with these plans and charge them a fee. I've seen this a lot with Part D drug plans as well, given that commissions have gone away for most on that from the agent's perspective. So my answer to that is, why pay $1,200 a year and then an ongoing fee when you can get the same thing for free? I mean, all the other brokers are going to do this for free. So why pay that amount of money when you can get it for free? The pitch of those people who are charging the fees, from what I have heard, is that, well, we're not getting commissions from any of the insurance companies, so we're going to be more unbiased than somebody who would only offer the companies that they are receiving a commission for. Okay, that's valid, but $1,200 a year, I think, is insane. And then at the same time, at least myself and my partners, if you come to us and you're like, look, I want this plan, and we aren't connected or contracted with it, and we aren't going to receive a commission for it, we'll still help you get it. If we're not contracted, we can't go act on your behalf and sign you up for it, but we can tell you exactly where to go to get it. We can see the costs of it. We will have some general, usually, experience with how that plan works. So yeah, don't pay to have Medicare advice. Okay. Perfect. Thank you for these comments. Chris, choose high deductible G. Very simple. In some cases, yes. In some cases, absolutely. Let me show you a video here that's on the channel that, if you haven't seen it, I highly recommend watching this video. It's this one right here. It's got the ripoff with my head acting as an O. Hopefully you can see that right there. So this is where I compare, if you were just on original Medicare only, you don't have any supplement plan or advantage plan, versus a supplement plan G, versus plan N, versus high deductible G, versus an advantage plan. And then over the course of the history of the channel, I've had people reach out, and then family members who have shared their costs on certain things. So for example, we've got a knee replacement there, we've got emergency room visit, we've got a heart attack, and then it goes up to cancer. And so depending on what your healthcare costs are and what's going on, a high deductible G can make a lot of sense for somebody who is healthy and doesn't plan on any significant costs. As soon as you start getting into significant costs in most states, that high deductible of the high deductible G is going to outpace the costs of the G. But again, if you're just betting on, hey, I'm going to have 15 years of good health, and then there's going to be 1 or 2 where it's going to be a struggle, just make sure that you're setting aside, you have some sort of a bank account. I call it kind of like earmarked as a health account. Some people have health savings accounts, which are fantastic. But if you don't have a health savings account or HSA, then have some sort of a savings account that you can set aside that's going to take care of, I would put it at, I'm conservative, so I'd put it at probably 2 to 4 years worth of hitting that high deductible into that savings account. That's probably a high yield savings account, get some interest on it or something. And then if something does go wrong, you aren't worried about coming up with that deductible cost. The mistake people make is they go, oh, I'm going to get a high deductible G, I'm going to save on those premiums. And then that difference that I'm saving in the premiums, they just go spend it and they don't save it. And now it's gone. So when you do have a high deductible year, things go wrong. This is the same general advice I have for those on advantage plans as well. If you have an advantage plan, set aside and earmark a savings account that's going to be 2 to 3 years of your maximum out of pocket on that plan, so that if you do have a crazy thing happen, you've got that set aside. There are also like cancer and hospital indemnity plans that kind of jump into there as well. Deborah, you read my mind. How do I feel about advantage plans but add hospital indemnity that hasn't had price increases? Yeah, usually for those who are going on advantage plans and have this conversation with us, we talk about the advantage plan and then a hospital indemnity plan and a cancer plan. If you are on an advantage plan, statistically, it's between 2 and 4% of people on advantage plans will hit their maximum out of pocket. So it's highly unlikely, but for those that do, it is usually coming from something like cancer, or it is coming from something like an inpatient hospital stay. The way that inpatient hospital stays are handled on advantage plans is there is a daily copay per day for days 1 through 5, as an example. So it's $300 a day for days 1 through 5. So if you're in the hospital for 5 days, that's $1,500. So that's how people usually hit their max out of pockets on an advantage plan. And so there are these hospital indemnity plans that if you get it, you set that coverage limit. A lot of people will set that at 1 or 2 times whatever the inpatient hospital stay copays would be. So I just mentioned $300 for days 1 through 5, so $1,500. They'll get a $3,000 hospital indemnity plan. If they go into the hospital, then the insurance company writes them a check for their $3,000 plan amount. And now they have that to pay and use however they want. Cancer works the same way. If you get cancer, I would recommend setting that amount at least one times. Usually we recommend two times whatever your max out of pocket is for your Advantage plan, because you're going to be hitting that if you get cancer with the coinsurance. So if my max out of pocket is $5,000, you get a $10,000 cancer policy. And then if you get cancer, they write you that check for $10,000. And I like that because if you get cancer, let's say the diagnosis is in August, and then you carry over into the next year, that's 2 years of your max out of pocket. So from August to December, you're going to hit your max out of pocket, and then going into that new year. I am not a proponent of over-insuring stuff. So again, if you have really high HSA balances or you have other things to offset that, don't get insurance policies you don't need. But for those who are worried about it, those can be a little bit of a lifeline there. What do I think about companies getting rid of broker commissions? Will brokers be around in 5 years? That's a great question. I hope that brokers are around, especially in the sense of how complicated this all gets. I don't get commissions in the same way. I've covered this on other videos. Like I don't get commissions from insurance companies at this point. That's why I don't care what plan you go with. I have my partners that will handle things. And so I think there will always be a space, at least for me, to come on here and tell you how Medicare is working. And then I can also get paid through YouTube and other ways. So I think that brokers not receiving commissions, I think that that's a way for insurance companies to deal with the added costs that are coming, and the government is putting more and more pressure on insurance companies to take on more and more risk without the benefit of profit. Profit is a reason they are in business, and so that is a very real thing. I still think brokers will be around. I could see if they cut all commissions, transitioning to what I was talking about earlier, those brokers or those agents that are going to transition into like a fee model where I don't know what the cost would be, say $100, and I'll review your Medicare plan and give you suggestions. So that's like worst case scenario. That's probably where I see it going. It would be great if I zoomed in on the documents. I 100% agree. Hopefully my beautiful voice was able to convey what was on there. If you want to shoot me an email, I have a link to a lot of these in the description. So if you want to shoot me an email, I can send it to you, or I'll put a link in the description as soon as I get off here of exactly where you can find those. And then you can cruise around and nerd out with all of those things in the same way. Carol, my understanding is health savings accounts cannot be used for supplemental premiums. Please confirm. Health savings accounts have a triple tax advantage. It's tax-free going in, it's tax-free growth if you invest it, it's tax-free coming out if it is a qualified medical expense. Supplement plan premiums are not an HSA eligible expense. So you can use your HSA dollars to pay for supplement plan premiums, but you're going to get taxed on any of those dollars that you pull out to pay for supplement plan premiums because they aren't a qualified expense. Just like if I took money out of my HSA to renovate my house, that's not a qualified medical expense. So those dollars that were in there and I pulled them out, I would get taxed on those. So you are correct. You cannot use HSA dollars tax-free to pay for supplement plan premiums. And in general, you can't use HSA dollars tax-free to pay for health insurance premiums, where that gets specifically medical health insurance premiums. That changes when you're going for things like dental, vision, hearing. If you're getting those as standalone plans, you can use it for your deductibles. You can use it for copays, coinsurance, all of that stuff. But that is a great question. In the recent news with the big beautiful bill is what it's been pitched as. There's some changes to HSAs that are specifically geared towards seniors, which I think are great. Not that I'm politically tied to anything. It's just from the HSA perspective of that bill. There's some really beneficial things for seniors, but it hasn't gone all the way through yet. So I can't really promise that will happen. One of those changes is that even if you're on Medicare Part A, you can still contribute to your HSA, which currently you can't do that. And so if that goes through, you would be able to, which I think is great. And then it doubles your contribution limits. Okay. Thank you for tuning in here. I usually use a secret code word in these and to see if people made it all the way to the end. So I'm going to reach out the first person to type in what they think the code word, as long as it's appropriate, should be for this video. That's what we're going to go with. So I'm just going to watch here the comments. You let me know what the code word for this video is. And if people have watched all the way through, what's interesting on these lives is as comments come in through the live, once it gets replayed as the non-live version, people can't see the comments, which is unfortunate, but um, I want to hear from you. What should the code word be? I know people have opinions on this. If you can't come up with it, I'm just going to share what is sitting on my screen as the background image for my computer. There we go. G-force. Perfect. And your tennis onion. I love tennis. All right. The code word here is G-force. If you leave the word G-force, then I'll know that you've made it this far in the comments. And then I'm going to run to my son's baseball game. Thank you so much for being here. And then again, if you have any questions, my email is eric@theretirementnerds.com. That's my personal email. It goes straight to me. You're not going to deal with some sort of a robot or AI or anything else other than me. So if you have questions, reach out. Happy to help however I can. Okay. Thank you, everybody.